Hi, I'm Dr. Jenn. I'm a health and wellness coach, and I specialize in helping people safely navigate benzo withdrawal. And today's video is about addiction versus chemical dependency. Had a lot of clients lately contact me and say, my doctor tells me I have an addiction, or my family tells me I'm an addict, and if I don't get off the drug and stop it right away, they're going to, send me to rehab or do something drastic. And so let's clear up some of the misinformation around the addiction and the chemical dependency issue with regard to benzodiazepines. Most people taking a benzodiazepine are taking them as prescribed. They're taking them exactly the way their doctor tells them to take it, and they are not abusing the medication. They're not taking more. They're not craving it. They're not, drug seeking. They're just simply taking their medication the way their doctor has told them to take it. But if they miss a dose, or if they abruptly get off, which is not recommended, or if they start to taper down on their dose, they may very well have benzo withdrawal symptoms. About half the people that take a benzodiazepine will eventually have some sort of benzo withdrawal syndrome. So when we have benzo withdrawal symptoms, that's really uncomfortable. And for some of it, it's very uncomfortable. And we have that because the drug has downregulated GABA receptors, which is the brain and the nervous system inhibitory system, the calming. So through no fault of our own, our brain has been remodeled, and we are now possibly getting more anxious or more insomnia or pain, whatever. There's a whole laundry list of possible benzo withdrawal symptoms. Now, we may want those symptoms to go away, so we keep taking the drug, or we increase the dose to get rid of the withdrawal symptoms. But that, my friend, is not addiction. That is simply wanting to feel stable on medication. And those changes in the brain don't indicate addiction either. It's a chemical brain injury. Any more than if you broke your leg. Having a broken leg does not mean suddenly somehow you become an addict. It means you have a broken leg. Same thing with taking a benzodiazepine. You've got a broken or a damaged brain and nervous system. The good news is that just like a broken leg, your brain and your nervous system are going to repair themselves. We just have to get out of our way and let them do that. They're designed to do that. So we don't have the hallmarks that go along with addiction. We're not drug seeking. We're not craving our drug. Our world isn't kind of revolving around our drug use. We just take our medication at the appropriate time. So there is this difference between true addiction and chemical dependency. And it's incorrect to say, oh, I've been on it, now I'm addicted to it. No, you're not. You're not an addict. You're chemically dependent upon it. So if you were to take a diabetic's insulin away, they would have a lot of horrific things happen to them. But that doesn't mean that they're addicted to their insulin. It means they're chemically dependent on it. They need it. Same with somebody. If you lower the dose abruptly, or please don't do this, unless it's really, truly medically necessary, to cold turkey, you're going to possibly have some really horrific symptoms. But that doesn't mean that we're addicts. It means we're chemically dependent. So it's really important that we understand we are taking our medication as prescribed, but even taking it as prescribed, we can still become chemically dependent on it and have a withdrawal syndrome. We can we can hit tolerance withdrawal, where the same amount of medication is no longer effective and we need more. Or for people, let's say they had a back spasm and they were put on, let's say, Valium to ease that spasm. And then a little bit over time, they start to get insomnia, or they start to get anxious, and their back is now tensing up again. And that's what can happen. Even people who never had a day of anxiety in their life can develop anxiety and panic and insomnia and a whole laundry list of withdrawal symptoms, because those symptoms are what happen when our GABA receptors are damaged. So please, let's really keep in mind that most people that are taking a benzodiazepine are not addicted and they are not addicts. Now, we got a whole cultural thing that goes along with this whole concept of addiction. I know that. There's a lot of negativity around the whole idea of addicts and addiction. I know that. And I'm not here to try to explain or, change anybody's mind about any negative viewpoint of addicts and addiction. That's not my job. My job is to safely help people navigate through benzo withdrawal. But I myself am in recovery from alcohol abuse. I've got 12 years of sobriety, and I treasure every day of that. My life revolved around, couldn't wait to go to a party where they had alcohol. I loved my wine every night. I wanted to stop, but I couldn't. I was addicted to wine or to any alcohol. But I was on a benzo for 18 years and I took it as prescribed. I didn't crave it. I didn't think about it, but I was chemically dependent on it. I'm now 11 years off my medication and I'm grateful for every day of that. So I'm here to just explain there's a difference between addiction and chemical dependency, and not because, it's a terrible thing if somebody's an addict, or no, like I said, I'm not here to even talk about the cultural stuff that we have around addiction. That's a conversation, to have somewhere else. I'm not putting down addicts is what I'm trying to say. I am one myself. I understand what it's like to be addicted to something. But I'm here to say that most people on a benzodiazepine are not addicted and they're not addicts. They are taking their drug as prescribed. And if they are tapering and it's becoming uncomfortable and, they're just overwhelmed and they're like thinking about, I just really wish I could take more, that does not make them an addict. That makes them so uncomfortable that they're doing their very best to feel more comfortable. And they think that by increasing the dose, that might happen. That's a whole nother video to do about updosing and kindling. And I will be happy to create that video. But today, this talk is about addiction versus chemical dependency. And if you've got a family member or a friend or a doctor or someone in your, medical circle that doesn't understand this and their interaction with you is causing you some emotional anguish, please book a one-on-one with me and have them on the call or have them book with me. I'd be happy to educate them. I've educated a lot of doctors and a lot of family members. Because I can understand a family member would just say, well, just get off the drug. Like, wish I could. I was actually in the emergency room. I felt like I was on the verge of having a seizure when I was coming off my benzo. And a doctor came in and told me I was an addict. I needed to go to rehab. And I tried to explain that rehab is like one of the worst ways you can get off of a benzo. You got to go slowly. And he goes, yep, see, spoken like a true addict. You'd really, you're dragging your heels. Just if you really wanted to get off the drug, you'd get off the drug. And whew, it's really frustrating to deal with uneducated medical personnel or family and friends that don't understand. We just can't get off quickly and we can't just stop our benzo. But those are other videos and I'm happy to make them. I am so excited. I am just fired up in a new way. I've been in this community for 12 years helping. I'm really fired up. 2023 is going to be the year that I roll out a lot more videos. So please, if there's a topic you want me to discuss, post it in the comments below or go onto my website, benzowithdrawalhelp.com. Leave me a message there. If you want one-on-one coaching to understand the 4 cornerstones of well-being, eat right, move enough, stress less, love well, that can help stack the cards in your favor for you to heal more quickly. And then to go on to be the healthiest and happiest version of yourself, book a one-on-one with me. If you'd like a really loving, supportive, amazing, positive, safe support group, go to my website and join Heal with Dr. Jenn. We meet 3 days a week on Discord. There's a lot of extra perks on there other than just, live coaching. And if you can't make the live sessions, they're recorded. You can watch them later. But we've got free classes, free this, free that, a data bank of symptoms. We've got a whole bunch of good stuff. I'm really proud of that group. It's just a remarkable group of people. So I'm here to help. So let me know how I can best support you and the Benzo community in the coming new year. I'm really excited about 2023. But in the meantime, please know you are most likely not an addict, nor are you addicted. You are chemically dependent upon the medication that you are taking as prescribed by a medical professional that you trusted. And let's close as we always do. Are you ready? We're going to say it twice. I am safe. I am healing. I will recover. One more time. I am safe. I am healing. I will recover. Till next time, take good care.